we have been a leader in global health in a way that has actually been a very powerful agent of soft power for this country, and to really help strengthen and make progress on a lot of health goals that have stabilized countries, led to economic growth, and put us on a path actually to sustainable development. All of that has been shuttered. And just to give a sense, there are the clinics in the countries where Seed Global Health works. Many of the clinics have just been shuttered and closed. And so people are going to get their medications, going to get services, and they can't get services. The reports have been that some of the funding has come back online, but it hasn't actually. And so there's a continued disruption of ongoing services that have happened. In Uganda, a country of 50 million people, which is a major hub of economic sort of engine for Eastern Africa and the continent, is facing an Ebola outbreak right now. Ebola is incredibly deadly in Uganda, and without U.S. funding and support, there has been a inability to really respond in the full way. And SEED has been one of the few partners that has been able to respond. And the problem with this is that, for example, the Ugandan government hasn't been able to put forth the kind of response it wants. So you can't track people who have traveled and maybe been found to be infected with the disease. The airport has had no contact tracing at all. And so you have the world, therefore, at risk in some ways from it. So what you're ultimately seeing is that millions of people's lives are at risk. But beyond lives, there's a destabilization of economies. There's going to be a failure of progress and development.